Hydrocephalus. Hydrocephalus is a condition caused by an imbalance in production and absorption of CSF in the ventricular system. It is the ventricular system in the brain. CSF is a full cerebral spinal fluid is a fluid in the brain. The brain consists of three. First is brain and meaning. Second is a CSF or the water. No. It's a fluid in the fluid in the brain, around the brain. And the third is circulation system, blood circulation. If the CSF is produced and absorption not equal, the brain has hydrocephalus. Okay, I will explain the normal pathway. It is the normal pathway of CSF flow. The CSF is production in colloid plexus, and then go through lateral ventricles, go to third ventricle, go through fourth ventricle, and go around the spine. Go through subarachnoid space, this area called subarachnoid space, and absorb that in this area called arachnoid villi. In this area. Okay, I will show you the clip video. Thank you for the clip นะคะ Okay, the CSF is produced in colloid plexus, go to lateral ventricle, go to third ventricle, go through fourth ventricle, go around the subarachnoid space and absorb that in this area called subarachnoid villi, and go to heart and lung and go back in the cycle. Thank you for the clip. Okay, next. If the production and absorption is abnormal like this, some part is impairment, let's make hydrocephalus. This is a summary. If the overproductions of CSF, here they cause hydrocephalus, or impairment absorption here, let's make hydrocephalus, or the blocking of CSF pathway. Blocking of CSF pathway at all sites. Yeah, this is a summary. Okay. Etiology. The cause of hydrocephalus are various and include either one is congenital, means since born. The example is meningocele, intrauterine viral infection is mean viral infections in the womb of mother. Aqueduct stenosis is mean like this picture, the blocking of CSF pathway at cerebral aqueduct is like here. The most case now is a developmental defect. It's the abnormality of the child since born. Let's make the hydrocephalus and since born to infant account for most cases of hydrocephalus for birth to the 2 years of age. It is a type of hydrocephalus. It is normal or the structure defect in the base of the skull and cerebellum. Type 1 is a downward placement of the cerebellar tonsil. Not too much, but type 2, the brain is lower more than type 1. Downward placement of cerebellum, brainstem, and fourth ventricle. Only type of structure defects in the base of the skull and cerebellum. Okay, next. This is the signs and symptoms of the hydrocephalus in infants. The sign and symptom: if the infant has hydrocephalus, is bulging fontanelles. It means the fontanelles is like this picture, with or without head enlargement. Scalp veins are dilated, especially when the infant cries. The bone of the skull become thin and suture become palpably separate to the product. And crackpot sound. I have the crackpot sound. It means the broken glass. Thank you very much for the clip.
And a pitcher. The pitcher has been cracked and broken, and so I'm going to show you the sound of the cracked piece compared to the regular piece. As you can see, as it's on a flat surface, it'll ding more like a bell. But the cracked piece doesn't really ding. It's a more dull sound, and that's because it's been cracked and the seal is broken. So hopefully this helps.
Thank you very much. And when you percussions in the bone, you will see in the bone skull, you will hear crackpot sound or McGuinn sign. On percussion of the skull. Oh, sorry. In severe cases, there may be frontal protrusion, like this picture, or frontal bossing, like this picture. These depressed are producing or setting sun signs, like this picture. Pupil are sluggish. Sluggish is mean pupil are constrict but slower than normal, with unequal response to the light, like this picture. Okay. In children, in childhood, the important is the signs and symptoms in early to late childhood or the causes by increased intracranial pressure. The pressure in the brain is more than normal. That may suppress in the brain, and the brain may dead. The symptom is headache on awaking with improvement after emesis, pupil edema, strabismus, ectopyramidal tract signs such as ataxia. This is a picture that you can remember in the infants has bulging fontanelles, suture separation, increased head circumference, high-pitched cry, and headache, seizures, some case, change in mental signs, vomiting, change in speech, posture is not normal, eyes is not normal, strabismus like this, change in loss of conscious. This is a sign of intracranial pressure. The onset of the increased intracranial pressure like it is on the weekend, with impairment after emesis, and may have this symptom after. The diagnostic and evaluation: fetal sonography as early as 14 to 15 weeks of gestation. In infancy, the diagnosis of hydrocephalus is based on head circumference that crosses one or more percentile lines on the head measurement chart within the periods of 2 to 4 weeks and on associated neurogenic signs that are progressive. However, other diagnostic studies are needed to localize the size of this obstruction. Okay, therapeutic management. The treatment of hydrocephalus is directed towards relief of ventricular pressure. Treatment of case of ventriculomegaly treatment is associated with complications and management of problems related to the effect of disorder on psychomotor development. The treatment is surgical. All the almost the case is surgical. Almost the case is surgical, with few exceptions. They have to surgical with BP shunt. What is BP shunt? I will explain next. The most children require a shunt procedure that provides primary drainage of CSF from the ventricle to an extracranial compartment, usually peritoneum. Some cases are right ventricle, but usually the peritoneum. This slide I will talk about VP shunt only. But some case is VA shunt also, but almost case, the most case is VP shunt, like this picture. I will have shunt procedures for you in the clip video. Thank you very much.
In the brain, the ventricular system includes the third ventricle, fourth ventricle, and lateral ventricles. The ventricles produce cerebrospinal fluid, or CSF, which circulates from the lateral ventricles to the third ventricle, the fourth ventricle, the subarachnoid space, and finally into the blood. When an obstruction develops in the ventricular system, it can block the normal flow of CSF, causing the ventricles to dilate and become distended. This abnormal buildup of CSF is called hydrocephalus. When severe, a buildup of CSF can compress brain tissue. The signs and symptoms of hydrocephalus vary with the patient's age. For example, in an infant, hydrocephalus may cause head enlargement, bulging fontanelles, eye fixation downward, and other effects. A ventriculoperitoneal shunt can relieve the pressure of hydrocephalus. In this procedure, a surgeon makes a scalp incision and creates and retracts a skin flap. The surgeon then makes a burr hole. Through the hole, the surgeon inserts a ventricular catheter and guides it carefully into the lateral ventricle. Next, a peritoneal catheter is inserted and tunneled down subcutaneously through the neck and chest. Along the way, a few small incisions may be needed. For example, the second catheter requires an abdominal incision to reach the peritoneum. Once both catheters are in place, the surgeon connects their ends to a valve and closes the incisions. The valve regulates the amount of CSF in the brain. In hydrocephalus, it decompresses the ventricles by shunting CSF to the peritoneum, where the fluid is absorbed and eliminated from the body.
Thank you very much for the clip. Okay, this is how to make the shunt procedures. The shunts will start with the ventricle and go to the back of ear and go to the stomach or peritoneal. Okay. Nursing alert. Some shunt is some shunt valve is a magnetically programmable shunt valve setting. That's the children or the child infants should be kept at least 2.5 centimeters. Tablets, computers such as iPads, and magnetic toys. Children or the infants should be kept at least 2.5 centimeters from the shunt valves. Okay, next is the complications. The major complications of BP shunts are infection and malformation. It is, crinkling, plugging, or separate, and migration of tubing. Malfunction is most often caused by mechanical obstruction, either within the ventricle from particulate matter or at the distal end from thrombosis or displacement as a result of growth. Functional obstructions of a shunt and siphon device remain a common complication. About 22% of shunt failures are reported within the first 90 days. The majority of these in the first month. Okay. This is a picture of the shunt infections can occur anytime, but the period of greatest leak is within the first month after replacement. Infection include sepsis, bacterial endocarditis, this means the heart, infection in the heart, wound infection, shunt nephritis, meningitis, and ventriculitis, and may be a result of intercurrent infections at the time of shunt replacement. The major complications of BP shunt are infections and malformation, especially the first month or within the first 90 days. Okay, nursing care management. The infants with suspected or confirmed hydrocephalus is observed carefully with signs if increased ventricular size and increased ICP. Infant, the height is measured daily as the point of largest measure, the OFC. We all study how to measure the height circumference already. Okay, I will pass. In older children, infants should measure the height every day. The height is measured every day or daily at the point of the largest measurement. Okay. In older children who are usually admitted to the hospital for elective or emergency shunt revision, the most vulnerable indicators of increased ICP are an alteration in the child LOC or level of consciousness, complaint of headache, and change in interaction with the environment. The baseline information serves as our guide for post-operative assessment and evaluation of shunt function. In infants, the heart is measured every day. In older children, is observed ICP or increased intracranial pressure, or observe the LOC or altered level of consciousness if the older children have the signs of an ICP or alteration of conscious change, nurse should notice immediately. Post-operative care. After the child or infant has the shunt VP shunt operation, the infant or child is positioned carefully on the unoperated side to prevent the pressure on the shunt valve. The shunt that had valve here that can, if they can press, and the fluid in the brain flow faster. So if this child had operated in the right side, the child the infant must turn to the left side down, the right side up, like this picture that he or she has operated in this area. The infant or child is positioned carefully on the unoperated side to prevent the pressure on the shunt valve. Okay. The nurse continue observations for signs of increased ICP that indicate obstruction of the shunt. Neurological assessment includes pupil dilation, like this. The black eye is bigger than normal. The nurse also observed for abdominal distension or constipation, because CSF may cause peritonitis, inflammation in the peritoneum. Or post-operative areas, like this picture, larger than normal because of fluids in the brain. Okay, next. Because infection is the greatest hazard of the post-operative periods, nurses are continually on alert for the usual manifestations of CSF infection, include elevated temperature or high fever, poor feeding, vomiting, decreased responsiveness, and seizure activity. There may be signs of local inflammation at the operative site and along the shunt tract. Antibiotics are administered by the IV route as ordered, and the nurse may need to assist with intraventricular installations, inspect the incision size for leakage, and test any suspect drainage for glucose and indication CSF. Okay. And family support. Specific needs and concerns of parents during periods of hospitalizations are related to the reason of the child hospitalizations. Nurse can calm their anxiety with explanations of the rationale underlying the various nurse and medical activities. They are especially frightened of any procedures that involves the brain. Nurse can calm their anxiety and explanation of the rationale underlying the various nursing and medical activities. Okay. Family support to prepare for child discharge and home care after the child have vision and doctor order child can go back home. The nurse should explain to the mother or parents that how to recognize signs that indication malfunction or infection that is a major complication, such as signs of an ICP, bulging fontanelle, and high fever for infection. Active children may be injuries such as A fall that can damage the shunt, and the tube may pull out of the lethal insertion site or become disconnected during normal growth. That if the child is growing up, the child must go to see a doctor every time, doctor at every appointment. Contact sports such as football, rugby, boxing, and wrestling are usually prohibited. Other sports such as swimming, like this, running, are acceptable. Helmet, helmet must be worn. Same epilepsy. Okay.